I've been in every medical profession just about in the book, between nursing, dental hygiene, massage therapist, hypnotherapist, and I use it all right here. I even do a lot of work with their jaws and their joints while they're laying there, and next minute, you know, they have a wonderful release and everything works good. Wow. They didn't realize that happens, but they love it. They go, oh, it's just a killing here. Open your mouth. I'm in there, and all of a sudden, how'd you do that? Magic buttons. I was trained in 2014, and I have been at Utopia for 6 months.
Now, is colonics the actual like correct terminology, or is it colon hydrotherapy? We hear different things. What?
They're all very similar because they're all using water. In some parts of the treatments, they're using different herbs, which are a doctor's order in Florida. However, mainly we use water through this machine that is heated up to about 102, 103 degrees. It's placed through a small tube into a speculum into the client. And there's another tube that handles any of the waste from the client to the sewer. It's a very comfortable procedure. It's usually 30 to 45 minutes long. And I usually set the client in the chair across from the table before we start, so they know exactly what's going on, so there's no fear or concern, because everybody is worried when they have this done. They're freaking out, thinking like the whole room's gonna be filled up with something. So I have to allay their fears, let them know every step of the way what we're doing, so they can become so comfortable, and guide them to a deep, slow breathing technique so they can have a wonderful session, and they really leave with a different state of mind as opposed to when they first came in. Everybody wonders why they get colds so often, why they get breakouts in their skin so often. It's very easily described as your immune system is your soldier. I mean, it helps you fight viruses, it helps you fight acne, it helps you to fight any pathology, because your immune system is 87% in your gut, in your colon. So while we administer lymphatic massage therapy, colon hydrotherapy, all those therapies together help to clean the body out. Cleaning the gut out is half the healing, because when you are receiving immunotherapy, IVs, vitamins, other herbs, things that help the body to build up the immune system, we have to clear out the immune system so it helps to absorb the new nutrients they are getting in. Teaching them with the proper foods, the proper amount of smoothies or whatever we're giving them with the vegetables. All their vitamins and things can be absorbed better into this system if their colon is clean. If you think about, you have this dirty garbage can, you take out the liner of the garbage can, do you actually ever hose your garbage can out? Every time we eat, we're leaving a layer of sludge. And if that sludge is not cleaned out, people say, I don't need a colonic, I poop every day. Great, good for you. But did you actually clean your body out? What do you mean? There's not going to be any poop in there because I go to the bathroom every day. They're very, very surprised when they empty out anywhere from 1 to 3 pounds of waste. This is the Clearwater hydrotherapy machine. It's invented by someone in Florida, and it's one of my favorite methods to use because I've used different methods, the gravity method, the open libbing method. There's other ones that are good, but I have found this with all the ones I have used, this is to be the most thorough and most comfortable colon hydrotherapy that I've ever used. And usually, if someone's more relaxed, say they're really uptight about the whole thing, they don't understand the open intro of why they should relax and things, and they're not breathing. Some people are very apprehensive about anybody touching their bottom. They don't want it. It's like, do you have a problem pooping? Well, no. I said, well, would you like to have some help with the extra junk that you forgot to get out? So after they're talked to and they get the water flowing, they relax a little bit more with the breathing, they find themselves, as the warm water floats in, their bowel relaxes, they release. They can actually see on the view tube here the waste that's leaving. They may see a lot of mucus, they may see a lot of hard little rocks, we call them. That's all been stashed into the pockets of the colon. The colon is 5 to 6 feet long. And you have that little bitty space that's been created for that space of the colon. So you have the organs cram in it. If your low back's out of place, that's going to cram into the colon. So when the water floats in, it actually inflates the colon a little bit to make room for the nooks and crannies to open. That's where the comfort comes in, because that's not ever expanded enough when you're actually having a bowel movement. The machine helps that. The water flows in at a very slow rate of speed. You can't even get too much water in there because I have a gauge there that shows me that I have the patient's pressure that's in their body, usually 0.1 psi, and the water floats in, and I can actually see the gauge move when they need to release. Because a lot of people don't even have the neurological function in their bowel. If they've had problems their whole life, they don't even realize it's time to release. They don't even realize, they don't feel it. The gauge makes it very comfortable. It lets me know it's time to let the water out. And the patient feels the release. They go, wow, I didn't know I had that much in there. And they feel very, very different afterwards. They feel comfortable, they feel relaxed, they feel happy. Because after the session, they're escorted into the bathroom. So take your time in there and see what else comes out. And they usually get rid of a lot more water, a lot more waste. This is a closed therapy system, yes. Some of the open ones are that I've used before, even on my own self, is not as comfortable because it feels messier. This is totally closed. All the fluid and the waste goes from the machine, from the patient, down into the sewer right away. The type of equipment's been in existence for many decades. It's probably 2 to 3 that's been working and got it so that it can be comfortable. Now, there's other machines that are out there that are not FDA approved, and those machines that have been used and not FDA approved, I have found using them, they do a fine job. However, they're a different classification of a device. And when people start researching things, they want something that's approved, that's comfortable, that they know is going to be clean, everything is disposable. So they research that and they want to know what's going to be the best for them. The other machines are okay. Like I say, they lavage the colon. Some of them don't have enough pressure gradient, so I don't find them as safe when I was using them myself, but they did a fine job.
How frequently do the patients here receive colon hydrotherapy when they're here?
They're usually placed on a protocol of 1 time a week. However, if we start finding out that the patient needs a little bit more, they usually have maybe 1 or 2 more a week. It just depends on the person, but 1 a week is usually the protocol. The water's being run usually 30 to 45 minutes, and then the patient takes that time to be able to go to the restroom. I'm cleaning the room for the next client, disinfecting the machine, and preparing the notes for the next client to come in. And the whole procedure they're in there, usually an hour in the whole appointment. Absolutely, everybody's covered from their shoulders to their toes. They're given a gown to place on, so everything is covered. They're given another drape to place over the lower half of their body, and they're also, a lot of times I give them a blanket to keep cozy and warm. A lot of people, I put a heating pad on their lower back, on their abdomen. They feel so cozy and warm. I have a few people actually snore during the session. The main thing I want them to know is that they're in charge of the session. If there's something that's uncomfortable or they don't like, or they really feel like they have to get up and go to the bathroom, then they are in charge. They say, I have to get up and go to the restroom. I don't say, hold on a minute. They are in charge. I turn the machine off. I help them to get into the bathroom comfortably, and the session is done. They're in charge of this session.
This is to detoxify the colon.
Correct.
And remove any built-up waste product.
Yes.
And things that would be preventing them from receiving new nutrition.
Correct.
Help.
Yes, it actually helps the nutrition to get into their bloodstream, because if they have a very, very dirty colon, people haven't gone to the bathroom sometimes in a month when they come here. And you know how much waste expands their belly, the gas, the bloating, all the extra bad bacteria, the funguses, possibly parasites. And they've actually said, why do I need this? And they start seeing their belly go down with every session. It answers for themselves. And they start saying, I can't believe how much better I feel.